for some math. When you add Medicare Part A plus Part B plus more, you get Part C. Part C is also called Medicare Advantage, and there's a good reason why. It's because Medicare Advantage plans help with hospital costs, doctor visits, and other medical services that you get with original Medicare. Plus, they can include prescription drug coverage, as well as coverage for vision, hearing, and you bet, even gym and health club memberships. All this comes in one plan with just one plan ID card. Medicare Advantage plans are run by private insurance companies. So how do they work? Well, for one thing, you have to be eligible for Medicare and paying your monthly Part B premium. For another, many Medicare Advantage plans come with an annual deductible to help keep your monthly premium down. You pay a copay or coinsurance for only the services you use and not for those you don't. Finally, to help keep your costs down, you may have to pick a doctor who's in the plan's network. Some plans offer more choices in doctors by letting you get services out of the network, but you may have to pay more. All plans are the same, and not all are available in every state or county, so you'll need to find out what plans are available in your area. For most, you can enroll in a Medicare Advantage plan when you hit the big 6-5, or once a year during the annual enrollment period. That's a good look at Medicare Advantage plans. Still want to know more about Medicare? Go to Medicare.gov or check the other videos in this series at MedicareMadeClear.com.